Welcome everyone. We're just waiting for folks to come in from the waiting room and then we will start, but we're very happy to see everyone's faces. Just give us one more minute. Great. I am Jessica Collins. I'm the Executive Director of the Public Health Institute of Western Mass, and very happy to be joined by this distinguished group of wonderful women, as it turns out. And so we are going to have everyone muted, obviously, as you are, and we will be introducing I'll be introducing the moderator, we'll introduce the panel, and we have a presentation of data for you. And then if you have questions, we're asking people to please put them in the chat, because we have several pages of beautiful faces, your beautiful faces. It's very hard to do any other mode. We want to make sure that we get everyone's questions. So if you could please put them in the chat. And then when it's the discussion and answer period, towards the end, we will be monitoring that and giving folks a chance to either say the question themselves or we'll read it for you. So at this point, I would love to introduce Ms. Nikki Burnett. She is born of parents that came from Georgia who met, married, and raised their children in Springfield, Massachusetts. She was raised in Mason Square in the 70s when it was called Winchester Square, and educated in the Springfield Public Schools and spent summers and school vacations in Georgia. Nikki received her Bachelor in Leadership and Organization Sciences from Bay Path and is currently in their master program in Leadership and Negotiation. She is the mother to a daughter who is a junior at Howard University in Washington, D.C. In addition to her work as Executive Director at Educare Springfield, Nikki serves on the Board of Directors, yay, for the Public Health Institute of Western Mass and on our Race and Equity Subcommittee. Also the Bay State Community Benefits Advisory Council, and she sits on many national committees. Empowering her community, raising awareness, and building equity have been her passion for over 20 years. She is one of the founders of the Faith-Based Health Advocates Alliance and has previously sat on the board of the Mason Square Health Task Force. Above all, ministry and service to others are at her core. She proudly serves in her church, Progressive Community Baptist Church, on the audio-visual ministry, Sisters of Praise Choir, and the Progressive Community Development Corporation. And Nikki, I want to just say thank you so much for everything that you do for our organization and for being here today to moderate. And you have to unmute. I'm so sorry.
Yeah, so that's the first for everyone on the call. You have to unmute yourself. Thank you, Jessica. It's so hard to hear people talk about you to you, but I thank you for doing that justice. So as Jessica said, we are going to have a wonderful presentation of very, very important work. We are going to let our speakers kind of flow through. I encourage you to please use the chat mechanism. Don't hold your questions and forget them. Put them in chat. We will have that to be monitored and we will add them in, but we will have a very robust question and answer opportunity at the end. So I would like to take the time to introduce the women that will be presenting the data to us. First, we have Kathleen Szegda, PhD. She's a Director of Community Research and Evaluation at the Public Health Institute of Western Mass. She has over 20 years experience in public health and research. She's worked at the national, state, and local levels for the U.S. Center for Disease Control and Prevention, Emory University, as well as Bay State Children's Hospital and the University of Massachusetts. She and her team have been conducting a youth health survey and youth risk behavior survey in the Springfield Public Schools as part of their ongoing efforts to use data to drive action and decision making. Next, we have Sharon Hall-Smith. She is the Director of Prevention and Community Services at the ndara Center, which includes the Stop Access and Drug-Free Communities Coalition. Sharon has worked in community-based public health in the Pioneer Valley for 25 years. She's been a valuable resource to our community. She focuses on programming that supports health equity. She holds a master's degree in public health from the Boston University School of Public Health. Welcome, Sharon. And last but certainly not least, we have Michelle Balch. Michelle has been with the Springfield Public Schools for over 15 years, and she is currently serving as the Senior Administration for Performance and Evaluation. She is the K-12 district leader of the Health and Physical Education Department and district-wide wellness initiatives. Please join me in welcoming and thanking these very powerful women for what they will share with us today. Next, we will have Kathleen Szegda present to us on the Youth Health Survey.
Thank you, Nikki. So I'm going to go ahead and share screen. Okay. So today I'm going to talk about the Youth Health Survey that was conducted. Hold on one second. That was conducted in 2019. So the survey that we are doing is part of the Springfield Youth Health Survey initiative. And so it includes the Youth Health Survey and Youth Risk Behavior Survey, and then also the Prevention Needs Assessment Survey. And we do that in alternating years. And it's a collaborative effort that includes a number of different partners, including Springfield Health and Human Services, ndara and their Stop Access Coalition, the Mass Gaming Commission, Springfield Public Schools, us, MLK Family Services, and this past year we're fortunate to have the MLK's Peer Health Advocates as part of our planning team as well, the young people. And then the only way that this happens is with our sponsors. So in 2019, it was the Mass Gaming Commission, Bay State Health, Springfield Health and Human Services, and Shriners Hospital. So we here at the Public Health Institute are the ones who lead us conducting the Youth Health Survey and Youth Risk Behavior Survey. I just want to acknowledge on our team, Kelly Wallner, who was bringing folks together and leading the group that was convening these two surveys, and then also Victoria Ramos, who did the data analysis, and very critical to these efforts. So the Youth Health Survey is done with 8th grade students, and we use a modified version of the state's survey that they do statewide. And then for 10th and 12th graders, we do the Youth Risk Behavior Survey, which is a modified version of what the CDC puts out, and that the Department of Public Health and the Department of Elementary and Secondary Education use as well. And we do this every other year. So we did it in 2019. Sharon will speak to the most recent administration of the Prevention Needs Assessment Survey after. And it includes a variety of topics, such as physical activity, diet, mental health, drugs and alcohol, violence, bullying, sexual activity, and more. So a variety of factors related to health. Today, I'm going to be focusing on the Youth Health Survey findings, the 8th grade findings, and it's an update. It's a report we just released to the report that we did several years ago as well from the Youth Health Survey. And so we focus on the Youth Health Survey because we've had a good participation rate over the years, although this past year it's improved with the 10th and 12th grade as well. So for this, we have a total of 1,267 students who participated, which was a 72% participation rate. So we feel pretty good about that. There's been a lot of effort to improve the participation rate. And so the folks who weren't necessarily participating, it would be as a result of not being absent the day that the survey was administered in their school. Their parents may have opted out, or they may have opted out. And in some cases, there may have been some logistical challenges related to implementing within a given school. So when we look at who participated in the survey, this past time in 2019, we see that when we examine by race and ethnicity, that it's generally reflective of Springfield Public Schools as a whole. So predominantly youth of color, and similarly reflective of, so 50% female, 50% male, and looking at sexual orientation, 81% heterosexual, and 10% bisexual, gay, lesbian, or unsure. So I'm going to speak some about some of the findings we have from the survey. As we talk about this, I just want to acknowledge and think about, we're going to be talking about data as a whole, and we've talked about on our team and from hearing from people, it's important to acknowledge that each of these are people and experiences they have. So as we talk about this as a whole, just keeping that in mind. I also just want to acknowledge that it may be that in some cases that as we compare to the past, we don't necessarily see a change, but there's so much great work going on, and it just may not be reflected in the data that we're looking at. So just to keep that in mind as well. So the first slide here with some of the findings was a question that we added as a result of feedback from the young people who are part of the planning team. And so they wanted us to include this, which is great. It's a question used on school culture surveys. And it was asking how strongly the students agreed with the statement that they were treated equally regardless of race, ethnicity, or culture. And so we see here that 1 in 4 students strongly agreed. However, more than 1/3 disagreed or strongly disagreed. So thinking about efforts going on in the schools, this was an important thing to keep in mind. And then similarly, when we looked at it and said how strongly students agreed or that they were treated equally based on their boys and girls or gender identity expression or perceived sexual identity, findings were similar. So we looked also at mental health, and we released a 2-pager on this a couple years ago, and there's a lot of work going on related to this and a lot of action, and you're going to hear Michelle speak about that shortly, about the action that's taking place in the schools and has taken place as a result of some of the data. Similar to the previous time, and again, it takes time for change to happen, about 1 in 3 students reported feeling so sad or hopeless almost every day for the past 2 weeks that it impacted their regular activities. So that's compared to 19% at the state level. And similarly to the 2-pager we reported, we continue to see inequities amongst females who reported at almost 2 times that of males, and among LGBTQ students, with 2/3 reporting this. So areas for continued work. Again, when looking also by race and ethnicity, similar to last time, it was similar across race and ethnicity. And when we look at suicidal ideation, we see that similar to in the past, approximately 15% of students considered suicide and 12% attempted. So an area of concern and for continued work. And we continue to see large inequities, 2 times more likely among females, and then particularly high and alarming too among LGBTQ students, with 44% reported that they considered suicide and 30% had attempted suicide. We see that when we looked at gambling, which is a particular concern given the opening of MGM in the community that we've heard in the community, very few students reported playing casino games or slot machines, only 3%, and 29% of students have gambled or played a gambling type game. And when among those who have, it was most likely to be gambling for games of skill, such as pool or golf. When we looked at bullying, so this is an area where obviously can have tremendous impacts on young people and students. It's a little different than some of the statistics put out by the school, but 27% reported being bullied in 2019. This is among 8th graders. Again, this is Youth Health Survey data. And we continue to see some inequities, so higher amongst female at 34% compared to males at 18%. And 1 in 2 students, 50%, who are LGBTQ reported being bullied.
Kathleen, I just wanted to do a quick time check. You have about a minute left.
Okay, thank you, Kelly. Sexual activity, so an area where nearly 9 out of 10 students are not sexually active. When we look at some of the questions we've added for this and areas for action that we'll talk about in an upcoming webinar, among students who reported having sex, 15% did not want to the first time and 7% reported being forced the first time. So we have a sexual violence against children and young women and youth in Hampden County, and that we'll be releasing, and that's the upcoming webinar. So looking at past day vegetable and fruit consumption, there's a lot of activity that's been going on, great efforts in the schools to change policy and systems, and also community school collaborations such as the LiveWell Springfield TCI initiative. And so we see that 57% of students have eaten vegetables in the past week 2 or more times, and then, or at least 3 times or 1 time, and then 68% have eaten fruits, but we can see more work to be done in this area as well. Similarly, for physical activity, a lot of fantastic work that's been going on, and we see that 61% of students 3 or more times a day have eaten or have been physically active at least 60 minutes in the past week, but again, more work to be done. And neighborhood safety is an important factor that impacts both mental health and activity, and it's an area to look at for considering action as well. And so young people in the survey reported that 31% don't consider their neighborhood to be safe from crime. 31% have witnessed someone being physically harmed in their neighborhood, and 21% skipped school at least once in the 30 days prior to the survey because they felt they would be unsafe at or on their way home to school. So again, more work to be done. As we look at this data, it's really important. I mentioned some of the change that's taking place and a lot of fantastic efforts. So just wanted to acknowledge the youth leader work going on, the MLK Peer Health Advocates who've been involved with the survey and policy advocacy, the fantastic work that the school leaders and school administrators have been involved with to make policy system and environmental change, and the school community partnerships that are going on, such as the LiveWell Springfield TCI and Youth Mental Health as well. That's a coalition that's forming. So thank you. I'll turn it back over to you, Nikki.
Thank you so much, Kathleen. Very valuable work. As some of us are not in 8th grade anymore, it's valuable to understand what the children are currently going through and the lens in which they see it, as opposed to how we as adults may frame it. So again, I want to encourage you that if there are any questions, please do utilize your chat throughout. I actually do have one question if I could pose. It was on the slide where you spoke about bullying, and we hear a lot about it. What was the question that was given to the students, and did it eke out whether it's cyberbullying, whether it's verbal, whether it's physical? Did they have the opportunity to differentiate what they felt was bullying and what type of bullying?
Yeah, so that's a great question, Nikki. And so on that slide, we did break it out. So bullying at school versus electronic bullying. And so there are some different ways it is looked at. And I'd have to go back and look at the specifics for how much we can break that out.
Great, thank you. And I don't see any further questions in the chat. And so I am going to move us along. And again, we will have the opportunity for very robust question and answer at the end of the presenters. And next, I am going to have Ms. Sharon Hall-Smith, and she's going to talk to us about the Prevention Needs Assessment Survey. Thank you, Sharon. Oh, Sharon, you have to unmute.
Thanks for that reminder. Thank you so much. I am going to share some slides as well. Okay. As mentioned, I'm Sharon Hall-Smith. I work at the ndara Center, and I work with our Drug-Free Communities Coalition, as well as many other groups in our Prevention and Community Services Division. I'm going to talk very briefly about some of the information on the Prevention Needs Assessment Survey, and I will refer throughout to a full report of the survey that is available on the ndara website on the Stop Access page that I'm also happy to send out to anybody who would like it. Sorry, I'm having trouble advancing. There we go. So the Stop Access Coalition is a group of residents and organizations that's managed by the Ndara Center and works to prevent and reduce underage alcohol, tobacco, and marijuana use in Springfield using public health strategies. And they take the lead on the alternate years on the Prevention Needs Assessment Survey. So the survey was administered in 2014 and then every other year through 2020. It was administered in February this year. And I will just put a caveat in here in terms of the data. I would say what Kathleen said, our 8th grade data has always been the strongest. This year in particular, I would pay more attention if you're looking at the report to the 8th grade data or the district-wide data, only because our high schools, and we had one high school that did not participate this year. They weren't able to participate during the regular period in February. They were scheduled to make up in April, but as we know, COVID intervened and they were not able to do that. So in 2020, we had over 2,600 students who were surveyed. Excuse me. And this survey is a survey that is distributed nationally by Bach Harrison, a national organization, and they described the survey as designed to assess student involvement in a specific set of problem behaviors, as well as their exposure to a set of scientifically validated risk and protective factors. Sorry. And that is one thing that is slightly different from the youth risk behavior surveys and youth health surveys, this emphasis on the risk and protective factors. So I'll talk a little bit about that and then a little bit about some data from the survey. So the risk and protective factors on this survey are divided into these 4 domains: community, family, school, and individual or self, and friends or peers. Excuse me. There are a lot of different labels and types of risk and protective factors that Bach Harrison has established on the Prevention Needs Assessment Survey. Some of them make sense just by reading them, some not so much. So again, what I would say, because we wouldn't have enough time to go through them all and explain them, is that these are all described in the report, and it also tells you which questions on the survey were used to compile which risk and protective factor. So taking a look at the results from 2020 in Springfield. You see percentages here. So what this is percentage of youth that they determined from the Prevention Needs Assessment Survey was exposed to this risk factor based on how they answered the questions on the survey. The top, the orangish brown, is the peer individual domain. The yellow is the school domain. The blue is family domain, and green is community domain. I'll just take one as an example. Perceived risk of drug use, you can see, is quite high on this one. And what that means, because it's a risk factor, is that those students are not perceiving substance use as being particularly risky. And so how would we use data? Why is it important that we have risk and protective factors? Well, this would allow us to say, maybe we need to figure out how we're going to communicate this better to youth. And for our coalition, for example, one of our strategies we might pick based on this data would be to go out to our youth advisory board and say, could you develop some materials that would be sort of peer-to-peer explaining some of this? Another option might be to go to the schools, to Michelle, and say, you know, which curriculum are you using? Is it evidence-based? What grade level are we using it in? That type of thing. So that's just an example of how this risk and protective factor data can be used. The protective factors, again, they vary a lot between these segments. They also vary within the segments. One thing I just want to highlight here is with the schools. In the previous slide, you saw that there were some risk factors that were quite high in the school section. Here we have protective factors. They're also very high in the school section. Rewards for pro-social involvement. If you go in and take a look at that, it just means basically that you're recognized and get praised or affirmed for things that you're doing that are positive within the school setting. So I wanted to just talk a little bit about the youth substance use, because that's what our coalition focuses on. The three substances you see here are the ones that youth use most at the earliest ages. If you take a look, the blue is alcohol, green, marijuana, yellow is tobacco, specifically cigarettes. And you can see that this is 2014, 2016, 2018, and 2020. You can see that there has been significant decline in all three of them from 2014 to 2020, although there is some variation. With small variations, it's sometimes hard to tell if it just is the particular group that's taking that survey or if it's a real change. So it's something we want to keep our eye on. We want to take a look at, is there a real increase in alcohol, 30-day alcohol use? And when I say 30-day, the question that the youth are asked is, in the past 30 days, have you even once used, you know, an alcohol, marijuana, smoked cigarettes? So whether it's a real increase in the use rate or, you know, just a slight variation. The thing that is a little concerning is if we look at our 8th grade 30-day use rate, it's a little higher than the national average, whereas all the rest of our use rates are actually a little lower than the national norm, which is wonderful, but it's just something we need to keep an eye on. The other thing that you see is sort of that leveling out with the marijuana. And this is actually something that's very typical in states where adult use has been legalized. So it's, again, something we need to keep our eye on because we don't want to see those rates start to increase because of a lower perception of risk based on this legalization. So the next slide is average age of first use. So students who reported that they had used substances reported what age they started. As you can see, cigarettes is the lowest, and many others are quite similar. The most important takeaway here is thinking back again to programming that we do with youth. There are a lot of times comments from parents that they don't want to talk to younger children about substance use because they think they're going to make them think about it, that they're not thinking about it. And what the data shows is that at least by the end of elementary, beginning of middle school, these students are being exposed because some of their peers are actually using. So we wouldn't at that point be suggesting it to them. They're experiencing it, and it would be good for us to get in there with prevention messaging, you know, earlier, before some of these students are starting to use.
Sharon, I just wanted to do a quick time check. Sorry for interrupting. You have about a minute.
Okay, perfect, because I was going to say this is my last slide, and I'm not going to spend a lot of time on it because it basically, I just wanted to show that it sort of mirrors what Kathleen had showed earlier. Numbers are slightly different, but they're pretty much the same messaging. So this is, the wordings of these questions are slightly different. They ask for this first one, if students felt depressed or sad most days during the past year, even if they may have felt fine on other days. 56% said yes to that question. And then in terms of suicidal thoughts and suicide, with the next one, we have also within the year, have you seriously considered attempting suicide within the past year? 18% said yes. Have you made a plan about how to attempt suicide within the past year? 15% responded yes. And 11% responded that they had attempted suicide in the past year. So very similar, just showing that sort of trend is continuing, and obviously very concerning. So I just wanted to say again that the PNAS report, the preliminary report, is available on the ndara website on the Stop Access page. My phone number and email are here. I would be happy to send out a copy of the report if someone has trouble accessing it on the web page. And someone from the coalition would be happy to come out and present about more of this data if there's interest, because obviously there are well over 100 questions on this survey, and we certainly didn't get to all of the data today. So thank you again.
Thank you, Sharon. We appreciate your hard work, and that data is very important. I just want to call, there's a few questions in the chat about the cigarette question. And the questions are, did they differentiate vaping when they spoke about cigarettes, or when they asked the question?
So the questions traditionally had been around cigarette. They added questions about vaping, but they couldn't be done over time because they added different questions. But there is some information in the report, yes, around vaping and what students are vaping. I will just put out there that that our data is showing that in Springfield, we actually have more students that are vaping THC, the active ingredient in marijuana, than nicotine. So it's just something good for us to know locally.
And another question regarding the prescriptions, prescription medications that the children that they're utilizing. Do you have information on the familial setting? We know that there are a lot of children, young students that are being raised now by grandparents or older caregivers. And of course, as we age, sometimes we have to have more prescription medications in the house. And you know, that in itself increases access that the students would have. Do you have any information of where they were getting the prescription medications?
Unfortunately, we don't. We have some information around alcohol and marijuana for that, but we had not added prescription drugs in that category. Unfortunately, this survey it's very long, and there's always this tension between adding more questions so fewer students are going to be able to complete it, you know, with stuff, but then leaving out some stuff that we really do want to know. So thank you.
Right, I gotcha. So here's, I know you said that the study was completed in February, I thought you said, of this year, but there's a question about the depression, suicide, and I don't know if you're doing follow-up data to see if the suicide attempts and thoughts and depression had increased this year, given the situation that we're in.
I think that will be very interesting to see when the next set of surveys is done in the spring, whether there is any change. Yes, this survey was administered right before things shut down, so it will be extremely interesting to see.
It will be very interesting to see that comparison.
Yes.
Thank you. And, as more questions pop in the chat, we will certainly go through them in the question and answer session. But next, I want to bring to your attention Michelle Balch, and she will discuss with us how the data is used in the schools and what perspective they're taking. Thank you, Michelle.
Great. Thank you all so much for being here today. I really appreciate it. And thanks for giving me the opportunity to share some of the work that we've been doing within Springfield Public Schools. This is definitely a community effort. I am reporting on some items that are district-wide and some that have been extremely important community partnerships. So thank you all for listening and your attention today. I'm going to talk a little bit about what we do with the data and how it does influence and impact our work in Springfield, particularly around professional development. That is a big part of my job with the district, is providing educators and administrators with professional development opportunities. And this data really speaks to us, and this survey data is so important to a lot of the work that we do, and it is shapes significantly some of the professional development that we've offered. So what we did was we took a look at the data and we really tried to hear what the students were telling us through this survey. And we created a plan of action based on the information that we received from the YHS and the PNAS data. We've also used this to apply for grants, really leverage some community partnerships, and prioritize district initiatives. This has really led to significant district-wide changes, and you'll see some of the work that we've been doing. Inclusivity training became a focus, and we saw this really come to fruition with the LGBTQ data that we received from the YHS. And we did some extensive work with assistant principals and principals. We've provided full-day trainings for our counselors and physical education teachers. And we offered over 25 professional development sessions in the spring, last year, the spring, and over the summer, where all educators and paraprofessionals were encouraged to sign up and take part in these inclusivity trainings. And the basic premise of the trainings is, like, what can we do to make our classrooms more inclusive for our students? And a lot of work around understanding LGBTQ needs in the classroom, and and also taking a look at the curriculum, even from ELA and social studies. What are students reading about? What are students responding to? And a lot of that work was done in response to the YHS. We had hundreds of educators attend these professional development sessions. We also implemented the second step curriculum, and this was really huge for us. Each school was able to, by choice, sort of identify social emotional curriculum that they chose. But last year, based on a lot of different factors, but particularly YHS data, really, we identified the second step curriculum, and that was huge. It was we implemented this year for elementary, and every school had to identify a team to implement the curriculum. And the team is City Connects coordinators, guidance counselors, and physical education health teachers that are going to deliver the curriculum. And these are they're providing the direct instruction. And we also made sure that schools carved out specific time to deliver this curriculum. We made it very clear that this is a district priority, that we are going to have our specialists teach the curriculum, and that there is going to be specific time allocated for this. So it was a cohesive plan. And again, evidence-based curriculum as well. there are specific bullying lessons that are incorporated into the second step. So not only are they getting the bullying lessons in their health and physical education class, they're getting evidence-based bullying curriculum lessons from this curriculum as well. And for secondary, we are looking this year to identify a curriculum that works for secondary. But in August, we also had PBIS, which is positive behavior intervention teams, sort of define what it looks like in the remote setting. So secondary curriculum should be outlined next year. We also this year started to implement educator goals, administrator goals around, they used to be SMART goals, so it was a little bit technical, but what we're trying to accomplish, we set that out at the beginning of the year. What we're trying to accomplish for our students and for ourselves as district leaders and educators, and we've included this IE portion this year, which means to really incorporate inclusivity and equity within our schools. So an intense focus on goal setting for all of us to make sure that it's a priority, because we know what gets monitored gets done. So if we set these goals for ourselves, it'll sort of run through the whole year, and then we'll have some additional data to support the work that's happening in the schools. I went through that extremely fast. And some of the other data that we also took a look at, and we looked at, I know Kathleen had spoke about the fruits and vegetables. We've also, I'd like to highlight our partnership with Sodexo in really delivering meals and making sure that this continues throughout the school year, increasing fruits and vegetables. We have the Culinary Nutrition Center, which was launched. It's been a really important part of the work that we do, and really making sure that our students are receiving the highest quality meals that they can. And that work was done through really community collaboration, Springfield Food Policy Council, TCI. It's been a powerful partnership. And we have breakfast in the classroom, in the typical school setting, but our Springfield Public Schools has worked really hard to make sure that students are eating healthy even while they're not in school. So our school meal sites are up and running and really effective right now. That is also another really important part. It's also measured in this. So I'm really excited to see what future years will bring about when we're talking about fruits and vegetables and that increase. And it's also led to wellness policy changes. So part of my role is really leading the wellness policy efforts, and through our community partnerships, we've been able to really leverage that policy and improve upon it. And that has impacted physical education, health opportunities, recess. That's all really intertwined with the work that we're doing around the wellness policy, and that could not have been done without our community partnerships and information from this YHS. It's really important to the work.
Thank you, Michelle. Thank you to all of our presenters. And so first, I want to say thank you to the other PHI board members that I know are here, Cindy Miller and Miss Betty Fredericks, and any other that are here supporting this very, very important work in all that we do. So I think I'm going to field it to Jessica to see if there are other additional questions that she has come across in the chat that we could now utilize for our QA session, as well as anyone else that has questions they want to pose now.
There was one that came in from Diane Trotterman for Michelle. Are there psychologists and psychiatrists available to the team, social workers for family therapy? And also, Michelle, I was wondering if you could talk about the training that went on in August in partnership with the mental health service groups.
Great. So a part of the SEL curriculum implementation are our school adjustment counselors. They're a part of the team, and there are specific modules that they deliver the bullying prevention and the child protection units, because they're a little bit more sensitive. We opted not to have them be taught in the virtual setting, that we're going to wait to roll those out because they're particularly sensitive topics, that we're going to wait until we're back in session to roll those out. But yes, we that partnership with our educators is really important, and they work extensively with our content delivery teachers to make sure that their students are all supported there. Our school adjustment counselors do a fantastic job of helping to support that work. Oh, and then the professional development. Sorry, we had the trauma-informed practices professional development. I am not saying the exact title correctly, but that was delivered to all educators across the district during August professional development. Again, it's making sure that we're carving out time to make sure educators have the professional development and support to help students through this trauma. We know that it became very clear to us that students needed support during this time. So a presentation was created that was delivered to every single educator in the district. And it was really talking about trauma and how to support students through this and develop these structures within your classrooms.
Great, thank you so much. Another question is with regard to the use of the data, which you've just given us terrific examples of how it is actually being used to inform and change what's going on with Springfield Public Schools. Question also around school committee. Does this data roll up and get presented to that policy making body?
I think that it's more of a grassroots effort too. So I know a lot of folks in the community work to talk to our school committee members and really get this information out. And I believe that, so it was brought to the attention of our superintendent by community partners and by individual members of the school committee. We've presented it to educators within the district, but really, I feel like it's a grassroots effort, which is really important. And those community partnerships really leverage the data, and it changes the work that we do at the district level.
Yeah. I just like to add to that because I know, Michelle, we had spoken a little bit about this, but in the mental health two-pager that was released, where I feel like it really had an impact on the people because it just, the information just really drove home that there was really a need to take some action. And releasing it publicly, one of the school committee members reached out and brought it to the school committee as a whole, but then simultaneously, while Michelle was working internally to, I think, do some of your professional development, she reached out to the superintendent as well. So just speaking to the grassroots effort of this and the need and the importance of people to take this information and then try and get it into hands of people who can make change and drive decisions.
So I have a question for both Kathleen and Sharon. What are your plans for follow-up surveys? They're going to be one next year. If so, what will that look like?
I can speak first since ours would be the one that would be taking place this coming year. So we're in preliminary discussion right now. We actually have a call next week. So we work really closely with that planning team I mentioned, but obviously the schools are a really key partner in this. So we have a call with Paul Foster, the Chief Information Officer, who is the point for the administration of the surveys in the schools next week. I think part of this is understanding, just given like our current situation, how much, like what makes sense to do at this point. I think we all absolutely understand that it's really important to have information, just knowing that this COVID has really probably exacerbated some of the challenges young people may be experiencing. But just the feasibility given the challenges the schools are experiencing in engaging students and families and the burden on families and students right now. So I think more to come soon, but we need to talk about what that might look like and how feasible it is.
I'd like to make a statement as soon as the next person is done.
Okay, thank you. Sharon, do you have any updates on what future surveys will look like and when that will be happening?
We're hoping to keep with the same every other year schedule for these two surveys. I would say what Kathleen said is absolutely, critical. And then the other piece that we struggle with is that we don't have dedicated ongoing funding for these surveys. So any suggestions people have, we would welcome.
Great, thank you. And what's that, Ms. Rhonda Jacobs that had something?
Yes. Hello, Ms. Nikki. So I don't know. I apologize for being a little late getting on to the call. I'm here along with, excuse me, a few of my staff, assistant principals, and counselors. And so what I wanted to share was this information from the surveys was confirming to us. We're very small in the alternative schools. And so we have the opportunity to assess all of our students' needs. But we learn a lot more as we get the individual site results from our students, from the surveys. But in the alternative schools, we've been fortunate enough to be able to put in place in-school counseling, and of course, implement and recommend out-of-school counseling. Some of our students have been able to connect with mentors. So the information that we receive from the survey is confirming, at least confirming. We already know, because we're so small, pretty much what our students need. And as my staff joined me here today, we of course are interested in hearing about the broader picture, because we received the students from the district, from within the district, that have struggled already to meet success in their regular schools. So I just wanted to inform you, we're here, we're listening, we take this information seriously, it's confirming, and it helps us guide more in the direction of where we already believe we need to go. Thank you.
Thank you, Ms. Rhonda, always for your voice. Do we have any other questions that anyone would like to pose, either on screen or in the chat? There's no more?
I would like to just say one thing that I didn't mention is that we also now have up on our website the report that we recently released. I showed it in one of the slides, but so please refer to that. There's a lot more information than what I spoke to, but in addition, we also have the responses to all of the questions that were included in both the youth health survey of 8th graders, but the youth risk behavior survey for 10th and 12th graders on our website as well. So people can go there to find more information.
And there was a question, someone wanted to know if the recording and the slides will be made available. Jessica's saying yes, yes to both. Yes to both. Okay, wonderful. Well, we are at time. We did good. We stayed good on time, which is great. And I just want to thank everyone, all of our presenters, and for the work that you've done, and for your succinct presentation of it. So many times we are so beat up with data, and we don't know how to get out from under it to really see what it's telling us and what we can do with it. So thank you for that. Thank you, Michelle, for giving the demonstration of how we use data to move forward to bring about change in services. So I thank you all. Again, I want to thank all the PHI board members that are there. Thank you for all the participants that did take your time to be with us. Everyone, and so we're looking at also in the chat, we're seeing some the link to the surveys as well. So please do click on that and save that so you can see it as well. And if there is, I guess I will bring Jessica on to see if she has any closing remarks that maybe I missed.
Well, again, thank you so much, Nikki, for doing this. I just want to bring again to people's attention that this has been a 3-part series, and the third webinar will be November 13th, again, 12 to 1. And it is a Hampden County report on sexual violence towards girls and young women. And so we invite you to come and hear, again, a very important panel discussion about that data. And so we're just so grateful that everyone's joining us, and have a great day.
Thank you, everyone. Have a great day, and everyone, please do stay safe.
Thank you.
Bye.